friends, I am Dr. Shekhar Srivastav from Sun Parmanand Hospital, and today I will discuss something which is very common in our population, that is arthritis of the knee joint. You must have seen your parents or some elder members of your family having knee arthritis, or you must have seen someone in your neighborhood walking with deformed knees. So how does it happen? So let me show you how the knee joint works. So this is our knee joint. That's the end of the thigh bone, that's the leg bone, and in between that is the joint. Now the joint is covered with cartilage. So cartilage is a cushion like structure which helps in shock absorber, it helps in weight transmission, and it also helps in smooth motion of the joint. So what happens when we age, then slowly this cartilage, it gets destroyed. Now as we grow old, because of wear and tear, what happens, this cartilage, it slowly gets destroyed because of wear and tear. So initially it starts from one side, destruction of the cartilage. Now as the arthritis progresses, as the wear and tear progresses, the whole of the joint, it gets destroyed. Along with that, there is also deformity in the knee joint and in the bones. So the bones, they become deformed, they get bowed. The knee becomes bent, they becomes bow like shape, and the patient starts having pain and difficulty in walking. So initially the patient will have pain on climbing stairs, then he will have pain even on walking on plane surfaces. Then gradually, as the arthritis progresses, they have pain even at rest. Now that is the condition when they start coming to us for treatment. Now this is something which can be prevented if we take care. Many people come and ask me that why does it happen to me and it hasn't happened to others. Now there are many factors responsible for this arthritis. First and foremost is aging. Then there's a familial tendency. That means if there is someone in your family who is having arthritis, then there's a high chance that you will also have arthritis. If you are not exercising enough, if your muscles are weak, that puts lot of stress on your knee joint, that can cause arthritis. Overweight, obesity, that puts lot of stress on your arthritis. Weak bones, that can also lead to arthritis. Along with that, if you had any injury in the knee joint, infection or rheumatoid arthritis, that can lead to arthritis. Now in order to prevent arthritis, first and foremost is that you should take proper care of your knee joint. You should not allow your weight to become more. You should avoid obesity. You should take good care of your muscles which control the knee joint. So you have to do exercises for your knee joint. These are very simple exercises which you can learn by physiotherapist in your neighborhood, or any orthopedic surgeon will teach you. Along with that, you have to maintain proper strength of your bone in terms of taking calcium and vitamin D, and you have to also maintain the mobility of the joint. So you need strengthening as well as stretching. Now what happens if the arthritis has already set in? So in that case, we give some medications. These medications, they help in preventing further loss of the cartilage. If the arthritis is advanced, in that case surgery is needed. So there are various options in surgical also. We can just do small keyhole surgery known as arthroscopy, where we remove the loose cartilage and the meniscus, that gives relief for some time, or we can also go for knee replacement. So in nutshell, arthritis is something which I won't say is totally preventable, but if you take proper care of your knee joint, much of its symptoms can be controlled and you can carry on with your activities. Thank you.